Hi, I'm Dr. David Hill, and today we're going to be talking about the remedies for infant ear infections. Now, let's first of all talk about infant ear infections. Ear infections tend, for the most part, to affect older infants who are 9 to 12 months of age. They can occur younger than that, starting about 6 months of age. Below that, while yes, they do happen, they're relatively rare. So we're really thinking about older infants here. Now, what do we do if there's an ear infection? We have the option over age 2 of doing nothing and watching to see what those infections do. That said, in the United States today, if your infant has an ear infection, we're going to want to treat that with antibiotics. Why? Well, younger babies, we think, are a little more susceptible to some of the complications of ear infection. Those can include infection of the bones around the ear and even a meningitis. So if we find an ear infection, we want to be pretty aggressive about treating. How do we know it's there? Well, the only way to know really is to get a good look at the eardrum. Your doctor can do that with an otoscope. Now, I've seen home otoscopes for sale at the drugstore. A, they have lousy light, they don't work very well. B, it takes most pediatricians probably a few thousand ear exams to get a really good sense of what it is we're looking at. So even if you can see the eardrum, unless you've seen hundreds or thousands of eardrums, it's really hard to know what's relevant and what's not in there. So first of all, the ear infection diagnosis really does need to be made by a doctor who's had a good chance to look at that ear. Now, we usually start with amoxicillin. Why amoxicillin? It is a great, effective, basic antibiotic. It kills the bugs that tend to cause ear infections without killing everything else under the sun. So some people say, well, my child never responds to amoxicillin. It's not the child, it's the organism. It's the actual bacteria you're trying to treat. Within 30 days of taking an antibiotic, most children will recolonize with wild-type bacteria. Now, if your child has had any antibiotic in the last 30 days, your doctor is going to want to choose an antibiotic from a different class because that child probably does have organisms that are resistant to the last antibiotic that was used, whether it was amoxicillin or something else. We need to treat usually for 7 days to 10 days, although in cases of recurrent or recalcitrant ear infections, we have to go longer, as long as 3 weeks. Now, many people ask, my child has an ear infection, should he or she have ear tubes? Those are tiny little tubes that put a little hole in the eardrum so the pus can get out when it collects. That's something that's best discussed with a child's ear, nose, and throat specialist or starting with the child's primary care physician. If your child has not had at least 3 ear infections in a 6-month period or 6 ear infections in a 12-month period, the chances that he or she will benefit from tubes are relatively low. So I usually wait until things have gotten pretty bad for a pretty long time before I ask a surgeon to help me out in deciding whether or not ear tubes are appropriate. Now, what can you do for pain? Tylenol is great. Ibuprofen's great. Those products work very well for pain relief when they're not doing the trick. Your child's doctor may also be able to prescribe anti-pain drops called anti-Pyrene Benzocaine drops. You may see them as Abiotic or Oralgan brand drops, but what these do is numb up the stretched, inflamed eardrum so that the baby can eat and sleep in some comfort. They don't do anything but just relieve the pain, but they're very effective there. Now, if your child has been on antibiotics for an ear infection for 3 days and does not seem to be getting better, you want to call that doctor back because it's probably time to make a change in therapy. Talking about remedies for ear infections in children and infants, I am Dr. David Hill.